Now we're moving on to our next discussion, which is known as a hypertrophic gastropathy. Hypertrophic gastropathy. So when you're hit with something like this, it might actually seem big, but if you eventually discuss the terminologies, it usually becomes very simple. So when you say something is hypertrophic, it just simply means the thing is enlarging, right? Gastropathy, gastro is the stomach, pathy is disease. So it's like literally enlargement disease of the stomach. Okay. So hypertrophic gastropathies, they are just group of rare stomach disorders, and they are characterized by thickened gastric folds due to mucosal overgrowth. Okay. So the most notable example is the Ménétrier disease. We'll talk about especially. So what are they? There is a spectrum of disorders. They are marked by giant gastric folds and abnormal mucosa proliferation. We have different types, but the most common examples we have the Ménétrier disease, also called the giant hypertrophic gastritis, or the hypoproteinemic hypertrophic gastropathy. So pathology, there's excessive foveolar. Okay, so the surface mucous cells are actually growing too much, glandular atrophy, okay, and all of that. So clinical features is what? Stomach pains, nausea, vomiting, anorexia, weight loss and weakness, edema because you are losing a lot of proteins, then hypoproteinemia. Okay, so that was it. So causes, it could be overexpression of transforming growth factor alpha. That's the most common examples. So other types, we were saying that the Ménétrier disease is the most common type, but we also have other ones like the Zollinger Ellison. We have the hypertrophic hypersecretory gastropathy. That one, there's so much acid secretion, okay, might lead to actually ulcerations and the rest of them. Then we have disease conditions related to polyps formation, like the juvenile polyposis and the Poets Jaggers. Okay, so you diagnose it with endoscopy, biopsies, and imaging, MRI, CT scans, endoscopy. You treat it with drugs like the endothelial growth factor inhibitors. So drugs like cetuximab. Then sometimes you might do surgeries in the stomach where you are removing some part or total of it. Okay, so that's what we have. Then for the ones that have secretion of acid, you also give drugs that will basically reduce the secretion of acid.